Hi guys. Uh,
Hello, guys.
Hi, how's everybody? Hope you guys are cool. Um, I'm just having a lazy day, so don't mind me. I've been on strike for 5 days and I had to go back to work today, so it's been
Hmm.
interesting. So I'm just sad that I had to go to work, but it's nothing that we know, we all don't know.
Calvin, doctors, we need you.
So yeah, anyway, thank you guys. Welcome to the show once again. It's always lovely to be here with you on a Wednesday. So yeah, greetings to everyone. Today we'll be discussing schizophrenia. It's basically a mental health condition. Am I echoing? Okay. It's a mental health condition that affects many people around the world, including our communities in Africa. I like to talk about these particular ones because I feel like these are the ones that usually get like the bad names and the bad stigma. So the name in itself, schizophrenia, is maybe a lot of you don't know about it. Let me know in the chats if you've heard of it or if you know what it is or if this is the first time you're hearing of it. And then as we go along, you might find that actually you knew what it was, you just didn't know it was called schizophrenia. So it's I just wanted us to talk about that today. This talk will hopefully help us understand what schizophrenia is, to reduce the stigma around it, and to learn how to support those who may be living with it in our communities. So to start off with, what is schizophrenia? It's a serious mental health condition that affects the way that people think, the way they feel, and the way that they behave, which is probably one of the most important things. So it doesn't usually mean a split personality or having a double personality, and it also doesn't mean that somebody is mad. It's a medical condition that is caused by changes in the brain. It affects about 1 in 100 people worldwide. So if you think about sitting on a plane, how many passengers does a plane usually take? Interesting question. But anyway, if you've got a group of 500 people, within those 500 people, 5 people have schizophrenia. So it's not as rare as people think it is. It's actually more common than usual. It usually begins in the late teens and late adulthood, and for that reason, that's why there's also a lot of stigma around it. People feel that is, especially within African communities, that it's to do with witchcraft and things like that. We'll come to it to the symptoms and signs in a minute, but is because it doesn't begin from an early age. It begins from your late teens into early adulthood. So a lot of the time, people feel like, anyway, we'll come to that in a minute. So their signs and symptoms can be broken down into three separate sort of categories. Number one is something that we call the positive symptoms, or also known as unusual behaviors. So if somebody says that they're hearing voices that others cannot hear, so that's called auditory hallucinations, or they're seeing things that others cannot see, and that's visual hallucinations. If they are having strange beliefs, those can be known as delusions. So somebody can say something like, every time that the red light turns on, then it means somebody's watching me. So that is an example of a delusion. And sometimes it can have disorganized speech and behavior. So if you've ever been speaking to somebody who they sound like they know what they're talking about, but actually Dr. Kojo does this very well. He made a good example. So they would say a lot of things using a lot of language, and you think, oh, this person's really smart, but you realize that their speech is disjointed. So one minute they can be talking about, today I went to the class and I was drinking a bottle of water which I found on the beach, and then I basically found the water at the bottom of the sea, and then the sea ended up in Africa, and Africa was on the plane. And so the person is making speech, they're talking to you, but none of it's making sense. So that's disorganized speech behavior. Those are the positive symptoms. Negative symptoms are things of lack of normal function, or what we will say normal function. So that's things like social withdrawal, people who don't want to be around people. Some people are actually scared of people, so they don't like to talk to people. There are people who will literally, I've seen patients who, they'll have their headphones in and they'll bury their head like that. And even if you try to approach them to ask for directions, obviously you don't know this, but you try to approach them to ask for directions, they'll have such a huge reaction to it, like, oh, don't touch me, or don't talk to me, or they might just run off, and you might think, oh, what a strange person, but that's basically social withdrawal, having lack of normal function, lack of motivation, reduced emotions, things like that. Even there's also, even on again, I work for DWP as a disability assessor one. So one of the scoring points that we used to get is if people cannot cope with changes in their situation. So there are some people who will always go to the shop and buy the same thing, and woe betides the day that they go to the shop and they don't find Colgate toothpaste. Like, they will have a meltdown. They will literally have a meltdown in the shop, and they'll be like, "Where's the Colgate toothpaste? Where is it? I can't find it. I can't find it." And they will literally have a meltdown, and you're thinking, "What's this grown person acting like this?" But that can be due to schizophrenia. And then the last category is cognitive symptoms. So things like poor memory, difficulty focusing or making decisions. So that's just sort of three categories. Whenever I do these talks, it's because most of our audiences are from Africa, especially West Africa, I like to sort of break it down into cultural beliefs and misunderstandings. So many people believe that mental illnesses are due to things like witchcraft or curses or evil spirits or ancestral punishment, laziness or bad behavior. And this is what I was saying, like sometimes if somebody's got the cognitive symptoms, which is the poor memory, difficulty focusing or making difficulty making decisions, they might be tagged as being lazy or just having bad behavior. If somebody's got the symptoms like the hallucinations, they might be tagged as having witchcraft or having been cursed or having evil spirits. Even things like that, ancestral punishments, and we tend to believe in things like that. But the important message here today is that schizophrenia is a medical condition. It's not a spiritual or moral failing. Like malaria or diabetes, it needs to be treated and it needs to be supported. And that, again, that's why this talk, I believe, is important. What are the causes of schizophrenia, I hear you ask? Basically, the most of it that we know is that there's a family link to it. So there's a family history or genetics. And again, where I come from, or where my family come from originally, which is Ghana, I've heard people say things like, "Oh, family wedi abodamum," or to translate that, "Oh, in this family, they've got madness in the family." So it's some of these things. It's not that they have madness in the family, but they might have schizophrenia in the family. So it presents as somebody who's mad, or by the way that our community see it, but actually it's a medical condition that runs in families. And just like sickle cell or diabetes, often if you go to see a doctor and they ask you, "What's your family history?" "Oh, I have diabetes in my family," that means there's a high chance that you might have diabetes too. It's the same with schizophrenia. So if somebody in the family has had schizophrenia in the past, it's likely that somebody in the upcoming generations or within yourself can have schizophrenia. So it's a family inheritance, and it's in the genetics. Sometimes there's a brain chemical imbalance. So a lot of things can cause that. It can be infections. It can be due to drug or alcohol abuse. It can be due to even things like stressful life events. Some people, they might have a familial background to it, but it might be triggered by things like huge stress in life. So losing their job or, losing a loved one, things like that can really sort of trigger the symptoms to come on as well. And sometimes as well, birth complications. So we have seen it in people who perhaps had forceps at birth, or some people who had congenital conditions. That just means had some diseases or abnormalities during birth, or having a traumatic birth. So things like that can also cause changes in the brain chemistry and how it works, and that can also lead to schizophrenia in the late teens or sometimes even earlier. We've seen schizophrenia in little kids. I had a patient sometime around this year, last year, who came in, bless her soul. Poor mum, she was terrified of her son. She had a son and a daughter, and her son had started exhibiting these symptoms. So it wasn't an African family, it was a Caucasian family. And she understood that there might be something mental health going on, but she was honestly frightened of the child. She said he would pick up stones like on his way home, put the stones on the table when they're having dinner, start talking to these stones. And sometimes the kind of stuff that he's saying to the stones are really scary. And then he would be physically abusive towards his sister and even towards the mum. And the mum came into the hospital and she was visibly scared of her son. Like, she couldn't go home that night with her son just because she was so terrified by him. The difference here is, in an African family, that son probably would have been taken to deliverance or to an exorcist or something, whereas obviously she knew to bring the son to the hospital. Don't get me wrong, I understand culturally there's a place for belief, faith and belief in these things. I'm not saying that I don't believe in prayer. I'm not saying that I don't believe believe in spirituality. I do, but I'm also saying that there's a place for medicine in these things. So I always say when I have these talks, especially with African cultures, to say that why don't you marry the two? Fair enough, you can do the prayer, you can do the fasting, you can do devotion, but also send them to a medical professional. There's nothing wrong with doing both. If one doesn't work, the other would work, isn't it? So yeah, so just be mindful of things like that as well. So why does early help matter? Because it prevents the symptoms from worsening, it improves the chances of recovery, and it reduces the risk of relapse and disability. So if somebody is found to have schizophrenia from an early stage, and I'll come to treatments in a minute, but they can be treated early enough, which means that they can live with schizophrenia, but they can live a very normal life. I don't want to throw my mom under the bus, but I remember when she first came to this country, and she was like, hey, and she was like, oh, that's why, you know, and to an extent, it's true. Somebody once asked me, why is it that we only see madness in Africa? You know, we see people on the streets being mad, the typical madmen that we see, but that's because there's actually no treatment or no cure for them in Africa. We don't take these things seriously, and we always attribute it to spirits. But how come we don't see people like this in this country? Because they're all on medication, and if you take your medication and you take it properly, you will not get the mad symptoms that we see. So actually, is it really the madness, or is it spirituality, or is it just the lack of treatment that we have? So that's why this is important, to be able to detect it early and be able to prevent it and prevent disability from doing so. Okay, so coming to the treatment options. There's medication. So usually we use medications called antipsychotics. They're usually prescribed by the doctor, so you can't get them over the counter. But you have to be diagnosed with something like schizophrenia, or you have to be diagnosed with something like a mental health condition with psychosis. So the symptoms I talked about, when we lump them together, we call them psychosis, which is basically psychotic symptoms. And yeah, so that's why we use antipsychotics to treat them, and they work incredibly well. Again, there was a professor one time, that I heard the story, I don't know how true, maybe it's a totally, but I heard it, that the professor wanted to prove to his students how well antipsychotics work and the importance of treatment on antipsychotics. And he said to his students, I'm a patient of like schizophrenia as well, and I take medications, and I'm going to do an experiment just for your sake. I'm going to stop taking my medication for 3 days, but by the end of the 3 days, please catch me and bring me back to the hospital and re-medicate me. And truth to his word, when he stopped taking his medications, just in 3 days, it was basically this renowned professor who was standing in front of students, teaching the students, you know, honorary professor and all these things. He basically became mad, ran down the street naked, and was doing all sorts of things. So they had to catch him, bring him back to the hospital, give him his medication, and he came back to himself. And if you've not seen it work, you've not seen it work. But from where I stand, I've seen a lot of it, and I've seen a lot of people who come in with psychotic symptoms. You give them medication, and just like that, it's like a light switch in the head. You know, it's like they go from this to that, and it's very clear. So medication really does work. There's also therapy and counseling. So people who may have had it triggered by things like life conditions or stress, yes, we can medicate them, but it doesn't take away the causative factor. So we just have to help them get through whatever it is, through that mental health that they might be facing. So if it's things like I said, if it's a loss, they might have to go through therapy for the loss, or grief therapy. If it's being diagnosed with a life terminal condition, they might have to go through some sort of therapy or some sort of counseling, family therapy, and then they can come out of that. So that's also important, but you can use that alongside medication as well. Occupational therapy often helps patients relearn how to live. So patients who are really badly affected with schizophrenia, so the ones that I talked about who struggle to cope, especially with little changes. If you think, there are even some people who say, I take the same bus every day, I take it at 8 o'clock, and if the bus is late by 1 minute, they have a breakdown. So in patients like that, we need to work with them to almost teach them how to relearn living skills in terms of, you know, learning how to cope with changes in situations. Some people have to actually even relearn things like cooking, their hygiene, their budgeting, because if anybody budgets, you know that budgets are never straight. I always start off with this salary, and I'm like, by the end of the month, I should have saved this much, and I'm always in minus my salary, by the way. So I'm always like, and yeah, budgeting's incredibly difficult. And but that's a skill that you need to be able to live. So yeah, just learning these kind of things, and occupational therapy will usually help with that. Things like occupational therapy will help with improving in social interaction. If they're school goers, returning to school, building a healthy daily routine. So that's the kind of things that you can do. Again, you can do that alongside medication, but medication is almost like the golden line, the first line that we use. And then the important thing I want to talk about today in terms of treatment is things like family involvement, community support, mental health services. You will not believe how important it is to have a community understand you or understand your condition. So if somebody you know, somebody that you love is going through something like schizophrenia and they're having the symptoms, they would appreciate it very much if they get support from their loved ones and their loved ones understand what they're going through, as opposed to being called names or, being made to feel like actually they're not, that they've been cursed, or, being actually, some people are even estranged from the family because they feel like, oh, Akoye Bibi Bonnie and he's been cursed and we don't want his curse to rub off on us and things like that. So family support, community support is very, very important in managing these patients. So if you are within that role of a family, you're not the patient, but you know somebody who's got schizophrenia or who has some of these symptoms, the most important thing to do is to be patient and supportive, to avoid stigma and blame, to encourage clinic visits and medications. Because oftentimes, if you are anybody who has a chronic condition and you have to take a lifelong medication, you will know that it's incredibly difficult to take medication every day. And sometimes these people lose motivation to take medicine. So even just being there to say, Kojo Wafa Wedro, Kwame, or clinic appointment next week, have you made sure to go to your clinic appointment? Just being there to even almost just be their, their guide, it's really, really helpful. And then involving the person in home and communal activities. So oftentimes when I say these people are scared of other people, but they've always got somebody that they can trust or somebody that they feel like they can rely on. If that person is you and you can take that person, so if the person is scared of going out to the public, be like, it's okay, I'm going to be with you. If you go to the shop and that person is freaking out or they're melting down because the Colgate is no longer there and there's only Aquafresh, be like, it's okay. We don't have to buy Aquafresh here. We'll just go to another shop and buy Colgate. Or I will go, just be supportive, just be there for them. You don't need to force them to change their ways. You can't force anybody to cope. If they're going to use Colgate, that's the only thing they're going to use. Trust me. They won't use anything else. But just being supportive to say, okay, you go home, relax. I'm going to go and find you. Because sometimes there are some people who have it even so bad that they will only go to Sainsbury's. They will not walk into Tesco. So even if the court say, and they will not go to any Sainsbury's. They'll go to the Sainsbury's on Oxford Street. They won't go to any other Sainsbury's. The day that Oxford Street Sainsbury's closes, that's the day that will take maybe one more year before they leave their house. Like it's really that it can be really that debilitating. And we see a range of patients. So obviously, I'm just saying that be aware of these things, and just be as supportive as you can. Okay. When to seek help. Visit a health facility if someone you know or yourself start to talk to themselves or hear voices. Now, don't get me wrong, I talk to myself all the time, but you know when it's sort of abnormal. I talk to myself in a sense that sometimes I can be like, maybe I'm running my day through my head, or I'm just rehearsing something in my head. But if it's a serious conversation, like you're having a conversation with somebody but you can't see anybody there, or a lot of the times these voices can aggravate them as well. So it's almost like fighting with somebody, being like, oh, leave me alone, and it's like they're actually having a conversation with somebody, or you are having a conversation with somebody. You're hearing these voices, you become aggressive, you become paranoid. Sometimes the voices can tell them that, oh, the government is watching them, or that if they leave their house that something bad's going to happen to them. So it's almost like these negative voices, not the normal I'm talking to myself kind of thing, like, oh, today remember to buy tomatoes when you come from work. Not that kind of talking, but it's really aggressive, really paranoid thoughts. If somebody shows real confusion, they stop caring for themselves immediately. They just become a bit like, for somebody who used to love to go out with friends, all of a sudden think that all their friends are aliens and that they've been put on earth to come and like the really, really strange thoughts and things that we would find as abnormal behavior. If there's anything that you feel like, no, there's something not quite right, just seek medical profession. So, sometimes these people will not even want to go themselves. So there's nothing wrong with going to your GP, especially if you know, for example, if it's a family member. Like, for example, I'm going to use myself and my sister. If I know my sister is going through something like that and I'm worried about her, I could go to our family GP and be like, when's the last time you saw Abana? I feel something's really going on. Do you mind doing a family visit on Abana, or do you mind checking? Because I've been hearing her talk to herself in her room, and sometimes it feels like she's fighting with her pillow. But you just mind checking in, and you can just say that to your family doctor, and your family doctor will always check in. No worries about that. So. Right, so that brings me to the end of my talk. The key messages I want you to take is schizophrenia is not a curse or a punishment or a witchcraft, or anything like that. It's a medical condition. It is treatable. Many people recover and live very normal lives. Again, I'm going to use us living in the UK or the Western world as an example. How many people do you genuinely see on the streets who you would say these are madmen or madwomen? That's because they're all on medication. And the ones that you do see, which is very rare, is because they've stopped taking their medication for some reason. And as soon as they're back on the medication, they're going to be normal again. So it is a treatable condition, and many people can recover from it and live very normal lives. As a community, we can love, support, and help with treatment, and it could go a very, very long way. So let us support one another with understanding and compassion. Mental illness is a part of health, and health is for everybody. Thank you. Was I talking to myself all this time? Hello?
Taptap Send. Oh, everyone, my baby, you're from Calabos. The only boss. With oneness, baby, I will be everywhere I day and everywhere they go. Taptap Send got me covered. If you need to send money or transfer money from Europe, from Canada, from USA, from UK, any part in Europe, you can send it through Taptap Send. And guess what? Oceania, they will receive it right here in Ghana and many countries across Africa. So what are you waiting for? Download Taptap Send now on Google Play Store or App Store. When you download, it's so easy to use. Tell your families, tell your loved ones to download Taptap Send. Okay? But also, when I receive my money, the other tell the world with channel, like my view, hey, you crazy.
Download Taptap Send now on Google Play and App Store. Taptap Send, it's secure, convenient, easy, and fast.
My name is Kwame. I am based in Düsseldorf, Germany, and I work for one of the leading smartphone companies back in Germany. When I decided to buy a land, I chose Apollonia because, first of all, through a recommendation from a friend, but I also took the time to come to see what the vision of Apollonia was and what the entire offering entailed. So after seeing the vision of Apollonia, the infrastructure that they had planned, and just the ease of the communication with the Apollonia team, the sales team, and basically everybody else I met here when I came, I felt very comfortable. I felt at home. I felt very well taken care of, and they were able to answer all my questions. And this was way back in 2019. Fast forward to today, I think I've made a very good choice buying land because I wanted to buy land to build the home of my dreams. I want to advise my friends and any viewer who's out there, especially those in the diaspora. I know your pains when it comes to investing in land and property in Ghana, and I have walked this path. And I have to say that this was one of the best decisions I made in Ghana to invest in Apollonia City, because I think the team here is genuine. There is no scam or any cheating happening here. I've been here now since 6 years, and I still come here at least twice every year. When I'm in Ghana, I always make sure to come and catch up with my projects and also meet the team. And I think this is one of the best investments I've made in my life. So I encourage everybody out there, please, if you're looking to come home, buy from Apollonia City and you won't regret it.
Hello and welcome back, guys. Sorry, I had a bit of a technical issue. I was trying to come back on and my laptop froze or something. But I'm back now, and thank you so much, Dr. Quiz, for the very informative session that we just had. So, I think we've got a first question. I was about to say, well, so just to explain this part of the show as we usually do. So this is the Q&A session. And for those of us who've just possibly joined, I also want to give a shout out to people watching on YouTube and Facebook, because we tend to forget you guys, but no, we love you guys and we remember you. And just to say, Dr. Akos just took us through a session on schizophrenia. It was World Schizophrenia Day like yesterday, so we kind of
Sorry? Awareness Day.
Schizophrenia Awareness Day yesterday. So today's topic is based on that. So we're now having the Q&A session where you can ask questions on the topic schizophrenia or any health topic or issue that you want to discuss. I think we've got a question in the chat. Yes, we do. So we'll open with a question from Zoom user, which says, you talked about medications. Have these not got any side effects? I've heard some medications that cause people to feel suicidal.
Yeah, thank you for that question. I think it's very important. And Zoom user, I recognize that picture. So welcome, sister, for always being here. We appreciate your presence. So when it comes to antipsychotics, well, not just antipsychotics, when it comes to any medication, there are definitely side effects, and a lot of medications have side effects. So I always say this when there's a popular belief in Ghana or in Africa that says that if you go to the hospital one problem, you can come back with 3 problems, because one medication that can cure something can always give you something. It's the same with antipsychotics as well. But the reason why medical professionals will use it is you almost have to weigh, when you're giving somebody medication, you always have to weigh the benefits against the risks. Okay. So in terms of you mentioned specifically about suicidal thoughts, most antipsychotics do not tend to give you suicidal thoughts, but there are some rare ones that do. But I think depending on each individual's case, you would be assessed by a medical professional, and then they will give you the medication that they feel is more suitable for your needs. So if somebody who's got psychosis or is experiencing schizophrenia symptoms also has suicidal symptoms along with that, they're unlikely to be given a medication that is likely to cause them to have suicidal thoughts. Even though most of antipsychotics don't give that, they do have other side effects. There are some that can can I even say they don't affect the heart so much, but they give you some changes on your heart readings, and there are ones that affect your sodium readings and your potassium readings and calcium readings. So before you're starting on all these medications, you do an ECG, you do a blood test, the doctor will make sure that you're fit for the medication they're starting you on before they start you on it. So I guess to just simply answer your question, yes, there are side effects, but the benefits of them outweigh the risk. It's better to keep you on those medications than not to, and that's why they're often prescribed.
Thank you, Dr. Akos.
Good character and background.
And thank you, Zoom user, for the questions. There's another question we've got a second question from John, which is, I know of a patient in Ghana who is on the 75 mg Invega. Is it Invega?
Yeah, I don't know what Invega is.
Okay, a month. I assume it's a schizophrenia is kind of medication. I could do a bit of a Google search. What would be a sure medical route of management to help integrate in terms of occupational therapy? So,
reassure medical route of management to help integrate in terms of occupational therapy. I'm not sure I understand the question. So the Invega is probably the brand name. So in the UK, we tend not to use brand names. So a lot of the time we use the actual organic name, which is, so for that reason, I'm just going to pretend that it's an antipsychotic. We know that it's going to be an antipsychotic. It's probably just going to have, so for example, it's like saying something like Panadol. Panadol is basically just paracetamol, but the brand name is Panadol, but the actual organic name is paracetamol. So basically, Invega would be an antipsychotic, yes. Abner?
I was just gonna say, do you know of a name of a medication called paliperidone?
Paradol, yeah. So that's basically
That's what Invigor is.
yeah. So that would be it's an antipsychotic essentially. So and that's what I thought. So it doesn't really matter what the name that you give us. We just know that it's an antipsychotic. But you said what would be a sure medical route of management to help integrate in terms of occupational therapy? I'm not sure I understand the question. Can you break it down a little bit more for me? I'm assuming that you're asking that what kind of management within occupational therapy can help the person integrate, but I'm not sure if that's what you mean. So can you please come back and explain that question a little bit more? And then we'll take the next question.
Yeah, we'll take the next question. So we'll just hold on. Okay. So we've got another one from Nancy, which is, does medication get rid of the illness permanently, or can you have a relapse?
You can have a relapse. So like most medical conditions or most chronic medical conditions, that's a medical condition that is not something that you can get rid of. It's something that you have to learn to live with. So I think that's what I talked about. When you take the medication, it's almost a lifelong medication. And when you start the medication, it's not something that we genuinely take you off the medication. It's almost like, again, I compare these things to things like high blood pressure or diabetes. Oftentimes, not to say that you can't come off your diabetic medication, you can do. But once you've been diagnosed with diabetes, you never become undiagnosed with diabetes. And this is the second time I'm saying this today, because I had to explain this to another patient today. Patient has had diabetes since they were like 18, but they've been off medication for the past 10 years. But you never become undiabetic. Once you've got the tag diabetes, or when you've been diagnosed with it, you're always going to have diabetes. And it's the same with these schizophrenia, because remember that number one, it's genetic, so it's in your genes, it's almost in your DNA for most people. And even the people who it's not genetic and they've sort of got it from a change in the brain chemistry, it's still almost a permanent lasting change. So you do have to be on the medication for a long term. But this is what we talk about. If you stay on the medication, you do everything the doctor tells you to do, then you're able to sort of live a very long normal life. And again, I'm going to compare it to something like high blood pressure. Once you've got high blood pressure, you're probably going to be on high blood pressure medication for the rest of your life. Once you've had a stroke, you're going to be on sort of antiplatelets and anti-stroke medications for the rest of your life. Once you had diabetes, you're going to be on. So it's just like any medical condition, you're going to be on medication for the rest of your life. As soon as you stop taking your blood pressure medications, guess what? Your blood pressure is going to go high, and you're going to suffer from complications of that. So if we think about mental health conditions and schizophrenia and all these other mental health conditions in the same way that we think of all our normal diseases, we really won't have a problem. I think it's just because we always box mental health conditions in a different category, and we feel like, oh, but there's no but there. It's a disease, and that's what it is, period. So yeah.
Indeed it is. It is your mental health. Just on the point of occupational therapy, as you know, like usually when the doctors are talking, I am normally Googling because, and I think occupational therapy, sorry?
Trying to keep up, huh?
Yeah, absolutely. So in terms of the question that John asked with occupational therapy, which obviously is you probably know what it is, but obviously it's integrating people back into activities they used to do. So I think that's
I mentioned in the treatment options that occupational therapy helps with relearning how to live your daily life. I talked about cooking, hygiene, budgeting. I talked about how some of the occupational therapy can improve social interactions. So if people are going to school, returning to school, or helping them maintain their rate. So I know what, I talked about it, so I know, but I'm just saying in this case and his question, the question specifically.
That was what I was trying to say, that I think obviously up until John comes and explains to us, but it's talking about what would be a medical route of management? I guess if the person is on medication.
It says what would be a sure medical route of management to help integrate in terms of occupational therapy. So what are we talking about, medical management here or occupational management? The thing is, there's no sure route. That's the first thing, because every case is individual. So like I said, I can't advice on that, because and that's what I mean. The question itself I don't understand very well, because it's saying what's the sure medical route, but then it says in terms of occupational therapy. So I'm not sure how I'm answering that question, if that makes sense.
Sorry, muted. I normally mute myself just to stop, interferences.
Yeah.
Whenever you forget yourself, you start talking. But yeah, no, absolutely, that's fine. Okay, we are wait for John to come and explain this.
I know that he's usually at work at this time on. I appreciate you so much, John, for always joining and trying and getting involved. So yeah, we'll just wait for you to have a moment, and if you're able to come back and explain that question, that's fine. If not, we can just DM me and we'll take it from there.
Yep. So I've got a hand up, but before I come to you, Auntie Liz, there's just a comment in there from Friedrich saying it's usually given IM. I'm assuming he's talking about
the Invigor. Yeah. So that's
okay.
Dr. Kobe. Welcome.
Okay, excellent. Okay, Auntie Liz, please.
I'm just intrigued about John's question. Dr. Coates, is it possible for somebody to be, I don't know what the 75 mg per month will mean? So what kind of, if you think about it, the 75, what are they taking per month? And is that enough to help them to manage their symptoms? Or I'm just...
no, that's fine. It's a good question. So I think that's why Dr. Kobe or Friedrich came to, I think it's Dr. Kobe. I don't know. I'm just assuming every Friedrich on the show is Dr. Kobe. But yeah, so when he said it's basically an IM, it's given IM. So IM just means intramuscular. So it's basically, sorry, I'm calling you. It's basically an intramuscular injection. It's just given like a vaccine or anything like that. And it's given once a month. So some people, and again, I think Dr. Kobe has more of an understanding of this because he's worked in Ghana previously. So I will let him come on after me just to maybe perhaps explain things a bit further. But I think what happens is even in this country, there's some medications that we give like every month or everything. If you've ever been on B12 injections, you know that we give that IM and we give that like every 3 months. So it's similar to this. So for some people, instead of taking tablet medication, it's preferable to take other forms of it. So in this case, I guess he's taking injections once every month for his antipsychotics, and that's how he's doing it. So that's my understanding of it. But again, I'll let Kobe come on to maybe explain a little bit further.
Great. Auntie Liz.
Hello. Yeah. So I think the medication is basically a haloperidol. So what we do is it's usually used when someone has a flare-up, like they're on your normal medications, and then maybe they have an episode where, they become extremely aggressive. So it's usually not a medication that we prescribe or we put someone on. The patient is probably on it once a month because he or she gets flare-up often. So they just basically put the patient on it. But there should be a medication the patient is on probably every day or weekly, to control the schizo. Yeah.
And I mean, that's a good point you raised, because I mean, when I thought the same thing when you said palperidol, because obviously it's in the same class as haloperidol, but I just, because for some people they get agitation and things, and I know people who are actually on daily haloperidol for things like agitation, but usually it's people who also have other conditions like learning difficulties or learning disabilities. So I mean, again, it's always good to have somebody who's perhaps practiced in the area, because the way that sometimes we do things can be a little bit different. So and this is what I mean by with things like schizophrenia and mental health, every condition, every individual is different, and the medication that we give is based on what the person's presenting with, the symptoms they're presenting with, how they react to the medication we give. So yeah, so I think it's a good clarification, and thank you for coming on to clarify that. So do you understand the question that John is asking in terms of occupational therapy and how to integrate?
Well, so I think the thing about haloperidol is it makes you extremely woozy. Like we basically give it to them to make them to sedate them basically. 75 is quite a low dose. I mean, you can do really high. So what he meant was if the individual takes the injection, they become a bit woozy. So probably they can't work on that particular day. So I think with that, they just probably have to work on around that. Maybe on that particular day, the person doesn't work or something of that sort. But the occupational therapy department in her company should be able to sort that out.
Yeah. Interesting. Yeah. I mean, I'm just looking on the BNF, which is the British National Formulary for the Invigor, and it says that they give it, so they can actually give it, but this is not through IM. So for intramuscular, for oral, they said it gives 6 milligrams once daily, dose to be taken in the morning, then adjusted to 3 milligrams if required, and then dose to be adjusted over at least 5 days. So again, like, we usually use it short term. It's not something we use long term. But again, we're digressing. But yeah, no, I mean, like I said, it's different in everybody, and depending on what we're treating, the symptoms that we're treating. So yeah. Thanks, Kobe.
Great, thank you, doctors. I've got a question here, anonymous. I'm sure you covered it in the beginnings, but is schizophrenia caused by witchcraft or curses?
I know why you laughing as you're asking that question. So I did cover it in the beginning, but it's, again, as I say, I'm not against spirit, and I said this in the beginning, I'm not against spirituality, and I'm not against things like that. I do believe in, things like that, but I'm also a doctor, and and I'm a scientist, and I'm a medic. So, there's a fine line between the two. And yes, people can experience sort of spirituality which can present like this. But my point of call is that, for me, it's always, if there's something that can be done about it, why don't we try that first? And this is what I said initially. There's nothing wrong with praying for yourself, or praying for a friend or a family member who's exhibiting these symptoms, taking them to prayer groups to pray for them. But why don't you also take them to the hospital for them to be given these medications? And both, you can target both of it from the medical point of view, and they say give what belongs to Caesar, and give what belongs to God. So as you're doing unto God, also do unto Caesar. So that's my take on stuff. So yeah, a simple answer to that is schizophrenia is not caused by witchcraft. It's not caused by curses. However, if you believe in that sort of thing, there's nothing wrong with praying and doing all the stuff that you believe will work, except stay away from the herbalists. They're not going to help you.
I had a question. I actually had a question. That was going to be I've got a few interesting questions trolling in here. But the next one was, can herbal remedies of lost question?
No, when I say herbalist, I don't mean as in herbal remedies. Like, I just mean these fetish priests. That's what I mean. Stay away from the fetish priests. They're not going to help you. But you know what? Actually, no, that's really wrong of me to say, because that might be somebody's religion. So I'm here saying, but yeah, no, if you believe that, go for it. But, at the same time, medicine is, schizophrenia is a medical condition, and medication works for medical conditions. So from my point of view, that'll be my first point of call.
So then, can traditional healing help schizophrenia then? Leaves.
I know what traditional is. I'm gonna give.
It's a big no from Friedrich.
Yeah,
okay.
I'm gonna give the answer that I always give on this show, and that my knowledge doesn't go that far. Now, having said that, it's not that I do believe in herbal remedies, and I believe that they do work. We've got, we actually have acupuncture and things like that, and we call them lifestyle medicine. We have a branch of medicine called lifestyle medicine, and they deal in healing and sort of using non-chemical ways to heal people, and that's fine. But from my knowledge, from my experience, and from the evidence that we have for schizophrenia, the simple answer to that is that there is no proven herbal remedy that can help when it comes to things like psychosis and schizophrenia. It's like, I don't know of any. So unless somebody can come up to me and give me an example of a name and say, oh, doc, Abia, I used this moringa leaf and it helped me with my schizophrenia, then we'll go and do some research on it, and we'll come back and tell you. Auntie Amma, where is she? She's the one who usually gives us this job. So maybe you should come and say, oh, the other day I mixed sobolo with ginger and I realized it was helping me with my schizophrenia. That was okay. We're going to do the research and we'll come back. But right now, I cannot really put my hand on my chest and say there is a herbal remedy that helps. Right now, all we know is that the only thing that helps with it is the antipsychotic medication. So no, I don't know about any herbal remedies.
Hey, Dr. Kos, good evening. I've got a visitor, that's why I'm not participating. But I've heard everything you're saying, and I'm going to come to you. Yeah, I'm going to come to you. I do understand you believe in medicine. Yes, I believe. I also believe in medicine, but medicine kwan doesn't help. What is spirituality kakra kamwa eboa?
Well,
You know, that is my take on that. So next time, now I'm going to show you my evidence base
no problem. Come back and give
with
us
my sobodo
homework.
and other things.
Come and give me homework.
I will come, yeah. But thank you so much. That was very good. And one of the things I wanted to just say is stigma, 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 stigma. Please, so be called all the through all this disease and now say challenges more. I just want to beg everyone. All you can do for people going through one thing or the other is the support. If you don't have anything to say, don't say anything.
Yes.
Just words of encouragement. I'm just saying this because I had somebody called me earlier. I was late Sunday night with the stage 4 cancer. And it was very difficult. He was so scared to tell even his own brothers. But somebody went in and pulled, it's a man, men don't talk, and said, oh, listen, I know someone who, went through this 9 years ago. And, so I had to call this person on Monday morning. And, he was like, oh my God, it's like he was so scared to even tell Onwan Nkrofo about what he's going through. We shouldn't be. We need to support each other, And by the time I finished with him, he was like, oh, thank you so much. So please, let's support them. If we can't, you wouldn't be cry. You just pray or just say, oh, it is well. That word, it is well, goes a long way. Just to encourage people to go through whatsoever, and then I'll be there, but you don't know when yours will come. So please, I'll beg. Every day we talk about all this, and it's very good that we are on this platform. It's really good because this man was telling me that, oh, I had a sweet tooth. Everything I like sugary things. I wish someone told me. And this is all we are preaching on this platform. So thank you, everyone, Taptap and Dr. Kos and your team and Abna. Thank you.
Thank you so much.
Yeah.
Thank you. And hello to your visitor. Please join us every Wednesday.
Okay, I will. I'm back from Ghana, so if you want that bedroom, I brought some.
Correct. Today we'll meet backstage.
Dr. Kos, many a bunch of fresh upon Chimba in Tiano Vejibi.
Men come a hammer for Rebecca.
Thank you, guys. We've got Frederick's hands up. I think he wants to expound.
He wants to come and debunk.
Oh, yeah, expound on that point too. So let's go on.
So usually when it comes to the traditional aspect of things, I'm someone that I believe there is a spiritual component to everything, even malaria, But the fact that I feel that way doesn't mean you should just pray and not treat it. When it comes to practicing in Ghana, you always have to be absolute. If you leave a nuance somewhere in the middle, they're always going to go towards the herbal side of things, right? I've had a patient, I think she was diagnosed HIV positive some time back. She was put on medications and she stopped taking it, and then she went to, a pastor. And then she was, I don't know how long she was there, but she was brought in with cerebral toxo. And guess who brought her in? It was just, the pastor just brought her and then just dropped her and left. At that point, there's nothing we can do about it, And I've seen people that, they did diagnose them with breast cancer, stage 1. We can do so much about it. And then they just go somewhere and then they come back and then it's like you're dealing with a stage 3, stage 4 kind of a scenario. So when it comes to, working with, this coming from someone who used to work in Ghana, I always, go choose that's why my answer was no.
Yeah, no, absolutely.
Because you put them somewhere in the middle, they're always going to choose the other one.
I understand that, but I guess and this is why having the two different cultures is very important, because from my stance as well, I can't give a no to that type of answer. Like I just can't, because that's not how I was trained in a way, if you think about it, or that's not how I practice. Because for me, yes, I'm a doctor, and yes, I know what I need to know, but I don't know everything, especially in, and I know that there are, so I totally understand what you mean, and maybe I should tailor my answers a little bit more to my audience, which is fine. But these my audience, they're all in the West, so it's fine, they understand. But yeah, no, the point you made about the HIV, and I have it's funny because we keep talking about Africa, but it's not just Africa. I had a very, very similar, in fact, the same situation, and it saddened me so much. I was first year in training. I was an FY1 at that time, a foundation doctor, and this lady came in. She's from Middle Eastern. She had breast cancer. We caught it really early. She has two young kids. One was about 6 months old at the time, and the other was like 2 years old, very young. The lady and her husband refused any medication. She literally refused any medication. A year later, just before I graduated to FY2, she came back in. This lady was almost dying. And we, even at that point, we were saying to her, let us give you chemotherapy. Let us give you radiotherapy. Even at that point, she was telling us no. She wants to do the natural way. And she's only coming because she's not feeling well. She needs us to make her feel better, and she can go back to her herbal remedy. The thing was killing her. She knew, but she was just very much against the medication. And it's a shame. And I know that I'm not of this idea that Western thinking is the best thinking. There's no way that I think that. But I do feel like sometimes, like Dr. Kobe is saying, if we start to wonder about these herbal remedies and these things, sometimes we actually miss the real medication. The things that we have evidence for, we have evidence based that these things work. Why don't we go for them instead of going on chance of, I know that there's some leaf in my garden that somebody spoke about. That's by chance. We don't know that it works. So yeah.
Great submission. It's quite sad with the lady, but yeah. Speaking on that same kind of like trajectory, I'm going on that same trajectory. There's a question here about, will the medication make me a zombie or dull my mind? So again,
I love these questions, and that just is a testament to how important it is to talk about these things, because people have a genuine misunderstanding on antidepressant and antipsychotics. Now, Dr. Kobe mentioned something about how haloperidol is almost a sedative, and yes, they are sedating agents. Some of them can act as sedatives. The ones that act as sedatives are the ones that we don't tend to give over long term. So again, Dr. Kobe was saying before, like haloperidol, there's drugs like diazepam. I don't know if anybody's on diazepam on this platform, but you know that you literally have to pull the hairs out of your nose before you can get your doctor to prescribe you diazepam. And even when you've gone to the hospital and they've prescribed you diazepam, if you go to your GP and you say, can I have this on repeat prescription, you know what ain't gonna happen. Unless we get like a written note from the
What's
Queen.
the deal with diazepam?
No, it's not just that drug. It's like diazepam, lorazepam, haloperidol. These medications, well, definitely here in the UK, we don't give them out like cookies because we know. For me, and I think, again, no, the number one, some of them can be addictive. Number two, they are sedatives. So if we give you lorazepam for a long time, if you're working, if you're a mother, if you've got kids, you will literally be sleeping the whole day. You won't be able to get up and do what you need to do. We only give these agents when people are really agitated. Just last week, I was on a night shift and one nurse came up to me and said, "Doctor, can you please prescribe sleeping tablets?" And I looked at her like, do I look like the sleeper man for you? No, drink some tea. Turn off the TV. I am prescribing no for sleeping tablets. And if you've gone to your GP or if you've ever asked for sleeping tablets from your doctor, you know that that's the attitude we have. We're not trained to give you these things for free. We're trained to scrutinize you. It's like going for a mortgage or car finance. I'll ask for your 3 months pay slip before I prescribe you any sedative. So, we do have like barriers to prescribing these medications. So antipsychotics in itself, again, depending on the type that you're given, some of them, yes, make you drowsy. Some of them can make you have there are some common side effects, things like dizziness, diarrhea. There's some side effects, but every medication has side effects. If you read your blood pressure medication tablets, they have all these side effects. Even COVID vaccine, they have all these things that we take, and this is again why I said that you have to look at the benefits outweigh the risks. if you're going to be a little bit drowsy and it's going to help you not go mad or not be experiencing all these other really horrific symptoms of having visual hallucinations, having these symptoms are really debilitating. Imagine living your life every single day thinking anytime that the traffic light turns red, that there's a sniper in Russia who's going to take you out. This is how people feel. And if you're going to be dizzy, but you're going to lose that symptom, a lot of people who are actually experiencing that would rather go for that. So my simple answer to that, and I like to talk, don't I? My simple answer to that is that it doesn't make you go cuckoo. It doesn't dim your brain. Yes, it can make you a little bit dizzy. It can make you a little bit hazy. There are side effects that people can have, but it doesn't make you lose any cognitive function. And like I said, a lot of people on antipsychotics live a very fulfilling life, a very normal life. You'll be surprised that some of your president, prime ministers might be on these medications. You just don't know it. Okay.
Yeah. That's true. I mean, this has been so great. Thank you so much. I know that these days Dr. Kos is trying to stick to a very strict schedule. But just to finish it off, like, how can one help a family member who has schizophrenia?
Again, I think I touched on this earlier, but number one is helping them get the diagnosis. So a lot of the time when people are going through these psychotic symptoms or these psychosis, they don't realize it. So oftentimes it's people around them who might be able to realize it. You see somebody acting funny. You see every time they're coming down the stairs, they are taking the left side and they're looking back. And then you say, oh, Adra, what's going on? Then they tell you, oh, if they take the left side, they will lose their leg. Or, there's some weird sentiment there, then okay, maybe. And this is what I said earlier when I said in that case you can actually go and seek medical help from them, because a lot of people, when they're going through the symptoms, they don't see it as being abnormal, because to them that's their reality. So a lot of people will not go to a medical professional and say, hey, I need help. So you as a family member need to be the one to recognize that this is what's going on and then help them get medical attention. Once they've got the medical attention, whatever it is that they need to do, whether it is that they need to take medication, whether they need to go to regular clinics, whether they need to go for 1 monthly injections. Oftentimes these patients in the beginning, when they're starting their medication, it takes a lot of encouragement. They need somebody to remind them to even take the medication. So if you're with a family member, just say, okay, every 8 o'clock, our tablet nana. Oh yeah, you have clinic next week. Should I drop you off? Things like that. And then just being supportive. When they come to tell you they're seeing things or they're hearing people talk, don't judge them. And even if you're judging them, don't make them realize you're judging them. It's okay to judge, but judge in your head, yeah, it's fine. We're all human beings. We know sometimes you go, this guy, what is he talking about? But don't make it obvious. If they come to tell you that, hey, Akos, don't step on the carpets, because if you step on the carpet, there's a snake under the carpet. You'll be like, but don't make it obvious, because if you do that, then you're going to lose their trust and they're not going to be able to come to you and open up to you. So just be supportive, be there for them. Take it as they're a kid. If you have a 2-year-old coming to ask you what we call silly questions, you don't laugh in the 2-year-old's face and be like, oh, you should know Pythagoras theorem by now. You take your time, you explain it to them, take them as a child, explain it to them, be there, support them. And that's pretty much all that they need. They don't need you to be their doctor. They just need you to be their family member. So in the same way that you support any patient, any family member who was diagnosed with cancer, any family member who was diagnosed with a long-term life condition, is the same way you just need to support them.
No, that's very great, and very heartwarming. What was I gonna say? Anyway, that's great. I was just about Prince Kobe. You are the last one. You just about made the time. I will spare you this time. If not,
you don't want me to go on time. That's what it is.
So Prince Kobe's will be the last question, and then you can close it off with any comments, encouragement.
Hey, I've got a question outside this topic, please.
Okay, Antil, it's for you.
Okay, so we got Prince Kobe's question is it okay for 40 plus to take multivitamin tablets with no health condition?
100%. That's a very simple answer. Even me, at this my age, I take multivitamins so every age have their own multivitamins.
Most multivitamins offer a 50 plus.
Yeah, they offer 50 plus. There are some young ones as well. Yeah, there's nothing wrong with taking multivitamins. Just my only advice is, if you said there's no medical conditions, that's fine. If there is a medical condition, check before, because sometimes there are some contraindications. You don't want to give yourself too many multivitamins. But if there's nothing at all, there's nothing wrong with taking multivitamins. Yeah, go for it.
Great. Okay. Auntie Liz said she has a question outside of the program. So I'm assuming, Auntie Liz, you want to ask your question after we've closed?
No, I think outside, not related to this topic, but something.
That's right.
Oh, not related to the topic.
Sorry. One day, I don't remember when, Dr. Course, you mentioned, like, when we're eating, we've got the windpipe and we've got where the food goes. My question is, if, like, tiny babies in incubators sometimes have tubes in their, and also elderly people. So that tube in the nose, does it go through? Can you explain it a bit, please?
100%. Oh gosh, let me quickly I'll try to get a picture while I explain this. So there's something called a nasogastric tube. So that's what goes through your nose, but it goes through your nose and then it goes into your gastric pipe as opposed to your windpipe. The reason why they put it through your nose is because it's just an easy access. So if you think about like putting the tube through your mouth, is going to be it's difficult, because why? Your tongue, you talk through your mouth, you bite through your mouth. There's just so many distractions there. Whereas with your nose, if you think about it, actually, really, your nose doesn't do anything except for breathe. And when you're breathing, you don't actually need to think about it. So the easiest way to actually get to down, and remember what I talked about, I said the eating pipe is at the back and the breathing pipe is at the front. So they're basically in the same place. They're like in the neck. So we just take it through your nose. When we get to the bit where, and remember I said whenever you swallow, your tongue basically covers your breathing pipe so that the food goes into your eating pipe. So if you think about it, if you've ever had a nasogastric tube put in, when the doctors put it in, they usually say when they get to a bit, they'll say, okay, now swallow water, or do a motion like so. In children it's different, obviously we don't get them to swallow, but when you swallow, is because your tongue then covers the breathing pipe, and then the tube will go down the eating pipe. So the tube actually goes into the eating pipe and not the breathing pipe, but it's called a nasogastric tube. So I'm trying to get a picture to show you, but my computer's frozen, so it's not the best. But yeah, no, I hope that answers the question.
NG tube for short. Thank you.
NG. Oh, thank you, hey, senior.
Oh, thank you. Thank you, Auntie Liz, for the question. Dr. Koi's.
Thank you very much. I know, Doctor, I now want to go home, so.
I don't know if you can see that. Can you see?
Yes. Go back a bit. Push your hand back.
You've got the blurry thing in the
My
background.
computer's acting funny. Oh gosh.
Yeah, I had my own earlier, so.
It's because I blurred my background.
That's because you blurred your background.
I'm trying to get it.
You can always share the picture in the chat, or you can't.
Yeah, I can actually. If you're on the OT, you're on the OT chat, aren't you? Yeah, so I can just share.
Or even in Zoom right now, you can't do that.
No, my screen is frozen. Like it won't let me do anything. Oh, there it goes.
I had a similar issue earlier.
Thank you.
There you go. So I've unblurred and you can see. Can you see that?
Yes. No, yeah.
The breathing pipe is the white one.
Yeah.
And the red one is the eating pipe, and you can see that it goes into your nose and then it goes into the stomach. Can you see?
Right.
Yeah.
Thank you very much.
Actually misses the breathing pipe. Yeah.
Yes.
Thank you, my dog.
Liz.
Anyway, no. Your uncle here, before today's topic, has given you the golden. I don't know if doctors get award. You would have the golden stethoscope, whatever you call it, because you are on top. You see, I said you're full of knowledge, and your uncle, like he's not listening, but everything goes in. Said, that young doctor is very knowledgeable. So I said, I will give it to you. Well done, girl.
Thank you, uncle. I appreciate it. Thank you.
Oh, on behalf of Dr. Coach, we thank you. And this is what it's about. Thank you guys for being so supportive of the team and of the doctors, and every single doctor we've brought, or not just doctor, medical expert, even down to the audiences, have so much knowledge to impart, and it makes this worth doing. But Dr. Coach, before I start ranting, could you please give your words of encouragement or close?
No, I just want to again just say thank you guys so much for always coming here on time, being here every week, without fail. Honestly, there's so much love from us because without you guys, this show wouldn't go on. But in the same time, it's just the way that you guys are so ready to receive the word of God, the message, and interact with us. So we really appreciate that. But I guess when it comes to schizophrenia, the message I really want to get across is that if there are any strange behaviors that you see in a family, in a friend, yes, there's a place for spiritual healing, but there's also a place for medicine. If you're not sure, just talk to your medical professional. If it's something that medicine can't do, they will tell you this is something we can't do. But there's always something that we can do. So if you feel like something needs to be, you're not quite sure where you are, there's a strange behavior, because sometimes even these strange behaviors, sometimes they can even be a stroke. Believe it or not, somebody can be acting really strange, but it can actually be a stroke. So if you don't start thinking that this could be medical and you start going down the route of they need prayer, you could actually really miss a life-threatening condition that could have been easily solved. So please, 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 just be attentive to your loved ones and be open-minded. And please, let's get rid of the stigma. So thank you. Strike,
that message with 10 bags of cement. No, you guys just got a pay rise.
No, see this, let me know. So the pay rise, we said we wanted 29%. The government gave us 5% and said they will increase it this side of the year. So they said they will increase it again. But now came this side and they're not going to do it. A deal is a deal.
A new government. Your contract was with the old government.
And so now we have to strike for this current government because we said we need an incremental. Now you can see how I'm suffering here.
Dr. Coase, apart from you, the rest of the doctors are sitting home doing telephone consultation. Why do you need 50% pay rise?
You see, that's
what I don't support you.
Auntie Liz, that's the difference. See, the doctors doing the telephone conversations, they're not junior doctors. You see, the consultants, have you had consultants strike? No, because consultants are on 100K and above. Junior doctors are on something like 20K. That's not even if you look at our pay structure, we're basically on something equivalent to £18 an hour. And I know people will say that locums and things, but actually, even if you take away all of those things, it's not, that's not a pay that we should be on. I studied for 8 years of my life thinking I was going to be ahead of my peers. Now all my peers, they are gone. Go look at the camera.
It's coming. Don't worry. Don't give up.
So we have to strike.
Don't give up. It's coming.
And you have to support us when we strike.
Yes.
Dr. Coase, I support you 200%.
Thank you.
I support. My cousin them support too. The others, I'm thinking
for me,
about
I don't know. Anyway, when it comes to striking, I do believe that doctors should get paid, should get the pay that you deserve. There should be some sort of pay rise for you guys, but I think the striking, balances a little bit. There are people dying,
But if we don't strike, how will they hear us? Because if we don't strike, they don't hear us.
But Dr. Coase, what you're forgetting is, when we give the title doctor, your peers don't come close. So, sometimes,
understand you, but it's not the title we go chop. See,
the title doesn't pay for the mortgage.
Mortgage day. What's this thing called? Childcare. Like, my pay is basically all of childcare. You can't even afford it. You can't afford to stay home. So it's not good. It really isn't. But
I support you.
The love of the people we serve, we still get.
We support you, but don't.
But Dr. Coase,
who is looking after them?
There's one thing I've also noticed. Even when you work in the NHF, the way they treat you, you don't get any first-hand treatment. They treat you the same. So sometimes it's so. When you are striking, me support them because they say, you treat you to say patient.
It's true.
Now, special treatment because I back you people. Man that whom St. Thomas say, yeah, mama.
Yes, we support you fully
because they have to pay you because you
Frederick, please. Being a doctor yourself, I know you have a lot to say on the topic. Please go on.
Yeah, when it comes to This is wild. This conversation is wild. Well, me personally, I've just been in the UK not so long, so I can't really be fighting on
You
paying
can
so much.
fight.
Hey, what Papa start to kuntemo?
But the whole point is, I knew I was going to move over since last year, early last year. So I've been following up on the whole negotiation. And my thinking was, they put a request for, I think, a little over 20%, I believe. And the agreement was, okay, we're going to give it to you, but you have to give us some time. Now, when you listen to the news, it sounds like everybody thinks you're asking for more money.
Exactly.
Instead of the money you agreed on last year.
Correct.
But then the whole thing is, they agreed on, I think, 25% or something like that increase. And then they were like, you give 5% now, and then we complete it
Later,
basically after yeah. Now it's like, it comes time for you to increase it, and you are like, nah, we are not doing that. I don't think that, it doesn't bring trust in the government. Because to be honest, the doctors here are leaving. They're going to Australia, New Zealand, and then
Canada.
the US. Yeah, and Canada, right? And Ghana has the same problem. I mean, I was in Ghana, and I left for UK as well. So it's like, the thing about our profession is, we don't have to get a new certificate in another country. We can just move. So that's the whole thing. If they don't do something about this and they keep antagonizing them, they're just going to lose more people.
It's true.
Yeah.
And we're all thinking of moving. So it means on my agenda. So
perhaps,
we beg.
This conversation
Dr. Kos, don't start, because childcare, you need to think about it. Mom is around, so please, man, yes, sir.
The conversation is taking a bit of a turn, but like being, just on the government might not be handling things properly, but like I said, I support doctors being paid well, but we also do have to bear in mind that there's a whatever billion hole in our budget. So
you're just talking because you work for the government. That's why you're here talking.
So all I'm saying is we just need to give the government some time to sort it.
We won't give them any time. Go and tell your boss we want our money. Thank you. That's all.
No problem.
Dr. Abner, when did you last have your pay increase, and how much what was the percentage?
Civil servants ourselves are also...
What was the percentage? Let's hear it.
5% now. It's 5% public servants. Public servants don't get more than 5% increase. We are also in the same boat. But
Dr. Frederick, I want to ask you a question. When you move from Ghana to somewhere else, do you get the cultural shock? Because like somebody put it,